Hello, welcome. This is Health Matters with me, Dishan Kumar, and we are in Hospital Kuala Lumpur today to talk about chronic kidney disease or CKD. Now, CKD affects a lot of us. We're going to be talking to a physician, Dr Sunita, and also a dialysis patient to just give us a very good insight on chronic kidney disease and how it's actually affecting everyone in Malaysia and why is it affecting so many people in Malaysia, and maybe steps that we can take so that we don't get chronic kidney disease. So join me in today's episode. This is Health Matters with me, Dishan Kumar. Alright, thank you Dr Sunita for joining us today. Can we start off with, maybe you can tell us more about chronic kidney disease or CKD and the status of kidney disease today?
Okay. Chronic kidney disease is a condition in which there's damage to the kidneys or reduced kidney function, which has persisted for at least 3 months. So basically, chronic kidney disease is a disorder that persists for a long time, as opposed to another condition which is known as acute kidney injury, where the kidneys suffer an injury but have the capacity to recover, and they do, right? So currently in Malaysia, we know that the prevalence of CKD is on the rise. There have been population studies that have been conducted. The first one in 2011, in which it was found 1 in 9 adult Malaysians had some form of chronic kidney disease.
1 in 9?
1 in 9.
Wow.
And when this study was repeated in 2018, the incidence has actually gone up now to 1 in 15 of the adult population being affected by chronic kidney disease. The main causes of CKD in Malaysia would be diabetes and hypertension. Diabetes accounts for about 65% of all new cases of end-stage kidney disease, and hypertension accounts for about 19% of these cases. But there are other causes. These include glomerulonephritis, which is a sort of inflammation in the kidneys. There are also inherited diseases such as polycystic kidney disease, obstructive kidney diseases due to kidney stones, or in some of our elderly male population, there is enlargement of the prostate gland which causes obstruction. And then there are various other less common causes like autoimmune diseases like lupus erythematosus, etc.
Okay, what is a lifespan from a person who has been diagnosed with CKD?
Okay. If you have CKD, there are several stages in terms of the kidney disease. The stages range from stage 1, in which there's a fairly normal kidney function, down to stage 5, which is what we call end-stage kidney disease. So actually, the early stages of CKD probably don't have an impact on mortality, but once you are in CKD stage 3 onwards, there is a reduction in life expectancy of patients. That's not because of the kidney disease by itself, but it's actually because there's an increased risk of cardiovascular disease, which is disease of the heart and the major blood vessels. There is no cure for chronic kidney disease, but it is important in the early stages that we diagnose the disease early. So in that sense, early detection is very important. So we always encourage the public, those who are at high risk, and that includes people with diabetes, hypertension, family history of having chronic kidney disease, those autoimmune diseases I mentioned earlier like lupus, rheumatoid arthritis, people who take chronic painkillers on a long-term basis. These are the ones who are a bit at risk of chronic kidney disease, and they should be going for screening. So if you pick up the disease early, there are a number of medical therapies we can institute to prevent the kidney disease from getting worse, right? But once it gets to a certain stage, then the remaining kidney function is not enough to sustain life. That's when dialysis or transplant becomes necessary. So these therapies at the advanced stage are not curative. They are simply there to replace the normal kidney function. But among the options, we would say that transplant is the best option because it improves patient survival and also gives them a better quality of life. Okay, if we look at data, we have a Malaysian dialysis and transplant registry. So we look at the data from this. We can see, like in 2015, of all the patients on renal replacement therapy, about 92% were on dialysis, and only 8% were actually those who had received a kidney transplant. So although kidney transplant actually has been available in Malaysia since the last 4 decades, right? What has happened is dialysis services have expanded, but kidney transplant has not actually progressed that much. I think the main issue is really a lack of the donors for patients with end-stage kidney disease.
So, lack of donors, people are not really signing up to be organ donors or things like that?
Yes, in that sense, there's been a drive to try to increase people to pledge to be organ donors, but quite a lot of change still needs to be made in terms of changing the public perception to come forward and pledge as organ donors.
Okay.
Yeah, you mentioned obesity, and that's another one of the diseases that's on the rise in Malaysia. So, in fact, if you look at statistics, there is this survey that's repeated called the National Health and Morbidity Survey. So, the last one that was done in 2015 showed that nearly half of the Malaysian population is actually either overweight or obese. And obesity has direct and indirect links to chronic kidney disease. Indirectly, obesity will increase those diseases like diabetes and hypertension, which are the main risk factors for chronic kidney disease. But directly itself, obesity causes more stress on the kidneys. It can cause protein to leak in the kidneys and also certain hormonal imbalances that contribute to the development of kidney disease. There's also an increased risk actually of renal stones or kidney stones and kidney cancers in patients who are obese. So this is the link between obesity and chronic kidney disease.
What about diabetes and hypertension? What are the links there for kidney disease?
Okay. Well, diabetes and hypertension, both of them are long-term chronic disorders, so they can actually cause damage over a long time to the kidneys. They also cause damage to the cardiovascular system, and sometimes it is actually some of the damage to the blood vessels that actually impair the flow of blood to the kidneys as well. So they're both again direct and indirect effects to the development of other diseases that impair kidney function.
It's an after effect of those diseases as well.
That's right.
Okay.
This is the thing that we would like to emphasize to the public, really, that chronic kidney disease is sort of a silent killer. In the early stages, there are very few symptoms. It's only when the disease reaches advanced stage that a patient may have non-specific symptoms like itching, swelling of the ankles or the face, perhaps decreased appetite, nausea and vomiting. So that's why the message is really to...
But those are also very general,
yes,
general symptoms.
You're right, they're very non-specific.
Yeah.
So quite often patients present in a very advanced level of kidney disease, which is a shame because if we had known earlier, there was a lot of things that we can do to try to prevent them from getting to that point. Yeah, I guess the most important thing is to maintain a healthy lifestyle so that you prevent diseases like diabetes, hypertension and obesity in the first place, which are leading to chronic kidney disease.
Well, are Malaysians being healthy in that sense?
I think that I would be positive. I feel that there's increased public awareness.
Okay.
Certainly, when I go out for a walk, I see many more people nowadays, and a lot of races and runs on the weekends. It's really taken off in a big way. So I'm hopeful.
Okay.
And I think for those who already have diabetes, hypertension, then the message would be to control the diseases well, so as to prevent the chronic kidney disease from starting or from getting worse. That these would be the main things. For those who have chronic kidney disease or even those without, another word of caution is about taking painkillers on a long-term basis or taking over-the-counter health supplements. Some of these supplements have not really been tested properly, so they actually might have detrimental effects on the kidneys. Okay. I would always say, if in doubt, then just ask your doctor for advice whether it's you should be taking supplements or not. Okay, there has been some news, I guess, about stem cell research that would offer the possible cure in the future for chronic kidney diseases. But I think this is very much in an experimental stage at this point. But certainly in terms of transplant, we have had an increasing armamentarium of immunosuppressive agents that have reduced the rates of rejection considerably. And in terms of dialysis therapies, both peritoneal dialysis and hemodialysis, there are advances in technology of the machines or in terms of the PD fluids that will enable better outcomes for our patients. The National Kidney Foundation's focus is very much on increasing public awareness about chronic kidney disease, how to prevent it and how to manage the disease. So it often has health screening activities, public awareness campaigns and things like that. So they help to educate the public, but they also do this in association with health professionals to also increase awareness about how to manage the chronic kidney disease. National Kidney Foundation often works in collaboration with the Malaysian Society of Nephrology. Now, the Malaysian Society of Nephrology, or MSN, is actually a professional society that consists of all nephrologists in Malaysia, whether they're in private, public, or the NGO sectors. And it's one of its focus of its activities is in terms of educating healthcare professionals about chronic kidney disease, but also acting as an advocate for maintaining proper quality and care of kidney diseases in the country. Okay, I think first of all, if they have access to the internet, there's a lot of information that can be gained from certain websites. The National Kidney Foundation website is www.nkf.org.my. And the Malaysian Society of Nephrology's website is www.msn.org.my. Apart from that, the government also has a portal, My Health. So if you just Google that, there's quite a lot of information there. For those who perhaps don't have the access to internet or prefer face-to-face consultation, I think they can actually approach most doctors in government medical clinics like the KK Klinik Kesihatan, and discuss with them whether they are at high risk and would they be able to get screening for chronic kidney disease.
Thank you, Doctor.
Thank you.